Hello there, welcome to Dr. Sushant's anatomy tutorial. In this video, I am going to talk about the lower end of the humerus. Again, please excuse me for the background noise. Now, the lower end of the humerus is actually expanded, okay, and it is called the condyle of the humerus. So this expansion is transverse. So it is expanded transversely, and this transverse expansion, it is the entire part, is known as the humeral condyle. Okay, so this condyle of the humerus, it has got articular and non-articular parts. So the condyle has got articular part and non-articular parts. First, let us talk about the articular part. So this articular part of the condyle of the humerus, it forms the elbow joint. Okay, so this elbow joint, by articulating with the radius and ulna. So with the participation of radius and ulna, the lower expanded part of the humerus, which is known as the condyle, forms the elbow joint. Now, what are the parts of the articular part of lower end? So the articular part consists of capitulum. This capitulum lies laterally, and there is this trochlea. Right. So the articular part forms the elbow joint with the participation of radius and ulna, and it consists of the capitulum laterally and trochlea medially. Let me show you this trochlea in the, the trochlea and the capitulum. Now let us take a look at this. This is the lower end, right? This lower end is expanded and it's called the condyle. So what we see here, this large expanded part is the medial condyle on the medial side. Laterally is the lateral epicondyle. Okay, medial epicondyle and lateral epicondyle. This one in white color, this is the articulating lower part of the humerus. So this consists of something called the capitulum, which lies laterally, and the trochlea, which lies medially. We can see the condyle of the humerus articulating with the radius and the ulna in the lower ends. So here is this is the capitulum, which lies laterally. This is medial. You can tell by this expanded part is called the medial epicondyle, and this is the lateral epicondyle. Now this structure here, this one is the capitulum, which is going to articulate with the superior surface of the head of the radius, right? Now this remaining part that lies lateral to the capitulum is called the trochlea. This is the trochlea. This is the trochlea. It's a pulley-like structure, trochlea, which is going to articulate with the ulna. Ulna here, radius here. Right. So this is the articular part of the lower end, consisting of the capitulum and the trochlea. Right. Now the capitulum. So let's talk about the capitulum. So this structure called the capitulum is less than half a sphere. Okay, it is not a complete sphere. It's not ball-like. It's like half a ball. So it's less than half of a sphere. That's the shape of it. It's just being compared to half the size of a sphere. And this capitulum, it is articular in front and below, meaning it is not articular posteriorly. So this posterior part can be palpated. Okay, in an extended elbow, you can palpate the posterior end of the head. Sorry, the capitulum. Right now, this capitulum, it is going to articulate with the superior surface of disc like head of radius, right? So I just showed you this. So here is the capitulum that is going to articulate with the superior surface of the disc shaped head of the radius, right? This is the radius here. So it is articular, as you can see, anteriorly and inferiorly, but posteriorly the capitulum is not articular, right? Next we will talk about the trochlea. So that's about the capitulum. Now coming to the trochlea. So trochlea, the meaning is it's like a pulley. It's a pulley shaped structure. It is actually an asymmetrical pulley, right? It is an asymmetrical pulley, right? So it is shaped like this, asymmetrical pulley, like this. Okay, so this is medial, this is lateral. So this trochlea is an asymmetrical pulley, and its articular surfaces are anterior, inferior, and posterior. It simply means that the trochlea has got this articular surface in front, below, and behind. Right? So what does this trochlea articulate with? It articulates with the trochlear notch of the ulna. So this trochlea is going to articulate with the trochlear notch of ulna. All right. Now, so here is the, well, here is the trochlea, and it's going to articulate with the ulna. So if I isolate ulna, you'll be able to see this hook-like area, this hook-like process enclosing this concavity inside is the trochlear notch. So this trochlear notch is actually formed by both the coronoid process and the olecranon process. Which one is the olecranon process? This upper part, this is this hook-like or hood-like, snake's hood-like, that's the olecranon process, and this one that lies below is the coronoid process. So these two together form the trochlear notch, and this trochlear notch is going to articulate with the trochlea of the humerus. You can see the shape of a pulley here, right? Okay. Now this trochlea, right, has got articular surfaces anteriorly, inferiorly, and posteriorly. So during flexion, it actually slides. I mean, when you are flexing, when you have flexed your elbow, the anterior surface is actually anterior, and a little bit of inferior part of the trochlea is in contact with the ulna, that is the trochlear notch of the ulna. When you extend it, you can feel the rotation, so that the inferior and little bit of posterior also comes in contact with the trochlear notch of the ulna. And we also have to notice that this trochlea is asymmetrical. You can see this is medial, and here we have this projection which is known as the medial flange of the trochlea. and then this small area is called the lateral flange of the trochlea. So what is this medial flange and lateral flange? It is nothing but an extension of the pulley. Okay, so this medial flange of the trochlea is more broad on the anterior surface, and its medial margin, this one, it projects about 6 millimeters more than that of the lateral one. Okay, so this is about 6 millimeters longer. So due to this reason, the forearm is deviated away from the upper arm in the extended elbow. Okay, so we have the humerus here, the lower end of the humerus, medial epicondyle, the trochlea, the capitulum, the lateral epicondyle, right? And here is the ulna. Here is the ulna. Ulna here. Medially we have the, and then we have the radius here, which is going to articulate with the disc-like upper end of the head of the radius. So here is the styloid process of the radius. Now the long axis of the arm, okay, the long axis of the arm is not coinciding with the long axis of the forearm. So there is actually an angle between the long axis of the arm and forearm. So this angle is known as the angle, that is known as the carrying angle. Carrying angle. So what is carrying angle? The carrying angle is the angle of deviation between the long axis of the arm and the long axis of the forearm. Now just try to extend your elbow. Just notice the long axis. The long axis of the arm and the long axis of the forearm, they do not coincide. So on the outside, there is this angle called carrying angle, which measures about 163 degrees. So this carrying angle is more pronounced in females due to the wider pelvis. Okay, so this is observed in extended and supinated elbow. Okay, extended and supinated forearm, right? So this angle helps to carry the load grasped by the hand without any contact of the medial border of the forearm with the lateral surface of the thigh, right? So this is the carrying angle, and this carrying angle disappears when you flex your elbow. All right, so that's about the trochlea. So the trochlea is actually an asymmetrical pulley, and it has the articular surface which covers the anterior, inferior and posterior surfaces, and it's going to articulate with the trochlear notch of the ulna. All right, and when you closely take a look at the trochlea, it has got medial flange and lateral flange. What is it? Medial flange. Okay, which projects 6 millimeters more than the lateral flange, right? Due to this 6 millimeter more extension of the medial flange, there is this carrying angle, which is the angle between the long axis of the arm and the long axis of the forearm, and it measures about 163 degree. Next, let us talk about the non-articular part of the lower end. So the non-articular part consists of 3 fossae and 2 epicondyles. Okay, 2 epicondyles. So what are these three foci? So on the anterior aspect, that is on the front, we have the radial fossa and the coronoid fossa, right? And posteriorly there is olecranon fossa. So non-articular part presents three foci. On the anterior surface we have two foci, the radial fossa and coronoid fossa, and posteriorly we have one fossa, that is the olecranon fossa. Right? All of them lie inside the joint capsule. Right? So let me show you these foci. See, this is the anterior aspect, isn't it? This is the front. You can see this is the front aspect. So when you look at the lower end here, so the articular part is this shiny white area. Now we have this small depression here lying above the trochlea, this area. This area is known as the coronoid fossa. And this coronoid fossa occupies the coronoid process of the ulna during flexion. So when you flex, this coronoid process is going to fit into the coronoid fossa. That is a non-articular, one of the three depressions. The second one is radial fossa. So this is where we have the radial fossa. It's actually a depression, and this depression occupied by the head of the radius during flexion, right? And then there is one more this one more depression. This depression is present on the back side, the posterior aspect, and you can see it is already occupied by the olecranon process of the ulna. Right, so that depression is very deep and is the largest of the three fossae. So that's called the olecranon fossa, and it is occupied by the olecranon process during extension of the elbow joint. Right, so the radial fossa is occupied by head of radius during flexion of the elbow. The coronoid fossa, okay, please remember the radial fossa lies laterally and the coronoid fossa lies medially, and both lie on the anterior aspect of the elbow, that is the lower end of the humerus. Now the coronoid fossa, it receives the coronoid process of ulna again during flexion of the elbow. And then we have one on the posterior aspect, that is known as the olecranon fossa, which is occupied by the coronoid process of the ulna, and that's during the extension of the elbow, and this is present on the which surface? Posterior surface of the lower end of the humerus. Next, let us talk about the condyles. Okay, so three fossae. So lower end non-articular part, we have three fossae. We already talked about the three fossae, and we are left with the two epicondyles. Okay, like I already told you, the fossae, they are within the articular capsule or the fibrous capsule of the elbow joint, whereas these two epicondyles, they lie outside, right? They lie outside the articular capsule. Now what are the epicondyles? So we have two epicondyles, one on the medial side and one on the lateral side. So on the medial side, it's called the medial epicondyle, and on the lateral side, it's called the lateral epicondyle. So these epicondyles are actually projections. They're very prominent bony projections, especially the medial one. Now see this is the anterior aspect, the front aspect. Now when I focus this area here, so you can see the medial epicondyle. So this projection here, this one is the medial epicondyle. It's very prominent compared to that of the lateral epicondyle. So here is the lateral epicondyle. So the medial epicondyle and lateral epicondyle both lie outside the joint capsule, whereas the fossae, the articular fossae, this one, the radial fossa, and the trochlear, the coronoid fossa. So this lateral one is the radial fossa, and this one here is a coronoid fossa. So these two is radial, and this is the coronoid fossa. So these fossa actually lie inside the joint capsule, whereas the condyles, they lie outside. So this one right here, the one on the medial side, is the medial epicondyle. Okay, it's the medial epicondyle. This one is a lateral. Okay, this is the lateral epicondyle. So I hope this is clear to you. See, the medial and the lateral epicondyles. Right, now let us talk a little bit more about the medial epicondyle. So this medial epicondyle forms actually a blunt, it's actually a blunt, palpable. You can actually feel your medial epicondyle. Okay, just semi-flex your elbow, or even if you extend your elbow also you can feel this. So in the immediate medial part of your elbow joint, you can feel this projection. It's the medial epicondyle. So it has actually a blunt, palpable projection. And this medial epicondyle is actually directed medially and slightly backwards. Okay, this direction, obviously it is directed medially, and it is also slightly backward. Okay, it is directed slightly backward also. Now what are the attachments of the medial epicondyle? So the medial epicondyle gives attachment to, that is the tip. Okay, tip of a medial epicondyle gives attachment to anterior and posterior bands of the ulnar collateral ligament. What is it? Anterior and posterior bands of ulnar collateral ligaments. So this ulnar collateral ligament is the ligament on the medial side of the elbow joint. Right, and this has got two bands. There's this anterior and the posterior bands, which are attached to the tip of the medial epicondyle. So just at this point of time, just remember that the ulnar collateral ligament is a ligament of the elbow joint. It has got two bands, anterior and posterior bands, and these bands are attached to the tip of medial epicondyle. There is more. The antero-inferior parts of the anteroinferior surface of the medial epicondyle is known as the common flexor origin. Okay, so what is the name of anteroinferior surface? There is a rough impression. It's called the common flexor origin. So what is the meaning? So we have the superficial flexors of the forearm taking origin from the anteroinferior surface of the medial epicondyle of the humerus. Okay, so what are these superficial group of flexor muscles of forearm? So we know the flexor muscles of the forearm are categorized as 5 plus 3. So 5 superficial muscles and 3 deep muscles. So the 5 superficial muscles are the pronator teres, flexor carpi radialis, palmaris longus, flexor carpi ulnaris, and flexor digitorum superficialis muscles. And the deep muscles are the flexor pollicis longus, flexor digitorum profundus, and the pronator quadratus. Okay, I'm just mentioning the names. You don't have to worry about these muscles at this point of time. These are the muscles of the front of forearm, arranged in 2 groups, superficial and deep. The superficial flexor muscles take an origin from the medial epicondyle. Because it gives origin to the medial epicondyle, the superficial flexor muscles, it is called the common flexor origin. Okay, and where exactly? Antero-inferior surface of the medial epicondyle provides origin to the superficial flexor muscles of forearm. Therefore, it is called the common flexor origin. Now, what else there is? There is a groove on the posterior surface of the base of the medial epicondyle. It is called the sulcus nervi ulnaris, meaning there is a sulcus on the posterior surface of base of medial epicondyle, and the ulnar nerve lodges in that groove. Therefore, it is known as the sulcus nervi ulnaris, meaning a sulcus for the ulnar nerve. Simply means that, right? So that is seen on the posterior aspect of the humerus. So this is the front. So when we look at the posterior aspect, we can see that there is this groove here. This groove is for the ulnar nerve. Now, let us just put the ulnar nerve in place. Ulnar nerve, the right side here. See, do you see this? So there is a groove on the posterior surface of the medial epicondyle, and this groove is for the lodgement of the ulnar nerve. Therefore, it is called sulcus nervi ulnaris. So you can actually feel your ulnar nerve here. You can actually roll it against the bone, and it produces a characteristic tingling sensation, isn't it? Some of us have done it during our childhood days. So just a tap posterior to the medial epicondyle, you can feel this tingling sensation. That's because your ulnar nerve gets stimulated, so you can actually roll it against the bone. Next, we are going to talk about the lateral epicondyle. What is the lateral epicondyle? Lateral epicondyle is this smaller projection of the lower end of the humerus. Now, the lateral epicondyle, as you can see, it is less prominent compared to that of the medial epicondyle, and the direction is lateral and slightly forward, whereas the medial epicondyle is directed medially and backward. The lateral epicondyle is directed laterally and slightly forward. And the tip of the lateral epicondyle, it gives attachment to the radial collateral ligament. So the radial collateral ligament is ligament of the elbow joint. Let me remove the nerve and let me add the radial collateral ligament. Yes, radial collateral ligament is here. This is the radial collateral ligament. You can see it is attached to the tip of the lateral epicondyle. Similarly, let me add the medial, the ulnar collateral ligament, so that we can see the attachment. Ulnar collateral ligament of the left side. Yes, see. So we can see the tip of the ulnar collateral ligament, the medial epicondyle, gives attachment to the anterior and the posterior bands of ulnar collateral ligaments. So this one right here. So on the lateral aspect, we have something called the radial collateral ligament. So the tip of the lateral epicondyle gives attachment to the radial collateral ligament. And also there is an impression in the anterolateral surface of the lateral epicondyle that gives attachment to the superficial extensor muscles of the forearm. Right? So antero-inferior aspect of the medial epicondyle gives origin to some of the superficial flexor muscles whereas the anterolateral area of the lateral epicondyle gives origin to some of the superficial extensor muscles of the forearm. Now, what is the difference here? The lateral epicondyle of the humerus, it is less prominent, right, compared to that of the medial epicondyle. And it has a muscular impression anterolaterally, whereas the medial epicondyle has antero-inferiorly, and its tip provides attachment to radial collateral ligament, whereas the tip of medial epicondyle gives attachment to anterior and posterior bands of ulnar collateral ligament. And the lateral epicondyle and on its antero-inferior aspect and anterolateral aspect okay, lateral epicondyle on its anterolateral aspect provides origin to superficial extensor muscles of forearm, okay, whereas the antero-inferior part of medial epicondyle provides origin to the superficial flexor muscles. Lateral epicondyle, anterolateral, origin to superficial extensor muscles of the forearm. Therefore, the lateral epicondyle is known as the common extensor origin. Common extensor origin. Whereas the medial epicondyle is known as common flexor origin. Alright. Also, the posterior surface of the lateral epicondyle gives origin to a muscle known as anconeus. So the posterior surface of lateral epicondyle provides origin to the muscle called anconeus, whereas the posterior surface of the medial epicondyle has a groove for the ulnar nerve. So always compare and then study. That makes the job easy. Okay. Now, what about the attachment of the capsular ligament of the elbow joint? So capsular ligament of the elbow joint is attached to the lower end of the humerus, and it is along a continuous line that excludes the two epicondyles, meaning the two epicondyles are outside the fibrous capsule or the joint capsule of the elbow joint, whereas this fossae, the non-articular fossae, are inside the capsule. So capsular ligament is attached in such a way that it excludes the medial and lateral epicondyles but includes the fossae, that is coronoid fossa, radial fossa, olecranon fossa within the capsule. So that's about the lower end of the humerus. So in lower end of the humerus, so I mentioned articular and non-articular parts. Right. So the articular part consists of the capitulum and the trochlea, and the non-articular part consists of the fossae, 3 fossae and 2 epicondyles. The fossae are the radial fossa, coronoid fossa, olecranon fossa. Now let me see. This is the joint capsule of the elbow joint. So here we can see the attachment of the joint capsule. So the epicondyles are actually outside, right? Epicondyles are outside the capsule, whereas the fossae, they are completely inside the joint capsule. Yes, so that's all I wanted to tell you about the lower end of the humerus. Thank you.